Good afternoon. Thank you for being with us today. I'm going to jump in with what we are all particularly curious about. It's our vaccination effort here in Rhode Island. I want to give a full update on where things stand with that. It's important to start with the understanding that the biggest challenge facing Rhode Island, like most other states throughout the country, is that we are not receiving a lot of vaccine supply right now in the state. That's our key component here. We have systems that are ready to go. We have the plans that have been developed. We need the supply to continue to push it out. We are doing the best that we can with what supply we have. As we get it, we are distributing it. The Centers for Disease Control and Prevention posts a map that ranks states by the number of doses administered per 100,000 people. Rhode Island is near the top. That means our systems are working, and I'm proud and grateful for the job that's being done. You can all be assured that as we receive the vaccines, our systems are in place to distribute it. As we've shared previously, we are getting roughly 14,000 doses of vaccine a week. When you look at our total population, that means 1.5% of our population each week. It seems like a lot, but it's that tiny fraction of our overall state population. And that is all we are getting for the week, with specific requirements even within that set allotment. We are posting data on our COVID-19 dashboard for doses administered. If you take a look at our day-over-day increases, roughly 2,000 doses are getting administered each day. Some days it's a little more, some days it's a little less. For example, yesterday we administered 2,920 doses. That's how we have our total doses administered of 45,643. When you think about 14,000 doses a week coming into Rhode Island, and that about 2,000 doses a day are administered, that means we're generally administering in a week around the same amount of vaccine that actually comes into our state in a week. This is an important point for all Rhode Islanders to understand. The number of doses coming into the state in a week is roughly the number of doses getting into the arms of individuals in a week. Getting those doses administered is a very operationally complex process. From beginning to end, it involves ordering the doses, having them shipped to our state, receiving them at the proper locations, redistributing them when they need to be distributed to other locations, then administering, along with many other steps in between. On top of that, once vaccine gets to a site where it will be administered, such as a health center or hospital or other clinical setting, patients have to get scheduled for appointments. That's a difference. We can't just have crowds of people showing up at once, given our COVID-19 pandemic. For that reason, the doses getting administered today arrived in Rhode Island a week or so ago. And the vaccine that we received on Monday of this week will get administered later this week or early next week because of those operationally complex steps that are in place. Because vaccine cannot get administered the exact day that it arrives in Rhode Island, there will always be a gap between how much vaccine has arrived in Rhode Island and how much vaccine has been administered. But everyone can be confident that the system to get that distribution going means that we equal what has come into the state is what has been distributed. As I said earlier, Rhode Island is actually doing well in the area of our system's distribution. To help illustrate this further, I want to make sure that this is clear because there's a lot of information that's out there. Up to this week, Rhode Island has received 72,175 doses of COVID-19 vaccine total. 16,757 of those 72,000 doses went straight to CVS and Walgreens because the federal government created a partnership with them to vaccinate nursing home workers, nursing home residents, and the residents of other congregate settings. Those 16,000 plus doses are not in our direct control. We are overseeing, ensuring that they are getting distributed appropriately and administered. But the ones that we are controlling is the remaining 55,000 doses that we manage and distribute as it gets out to the partners for administration. We coordinate when and where those doses go once they get to Rhode Island. So the number from that 55,000 is critical. Of those 55,000 doses that the state has been managing directly, 50,100 doses have been distributed to a point where they were or will be administered. That's 90%. That's why we are acknowledged as one of the top states in administering doses of vaccine. As a reminder, for the most part, the state itself is not overseeing the actual administration of the vaccine. We oversee the ones that are received here in the state and then distributed. We monitor the federal partnership program for distribution to our nursing homes and other congregate settings. Then we work with our partners to actually ensure the administration occurs. We're coordinating its shipment to places like hospitals, health centers, clinics for people in higher risk occupations, and other sites that we are being extremely creative and thoughtful about working with to gain access to vaccine. Generally speaking, the healthcare providers or organizations that receive vaccine from us after we distribute to them, they are taking that last step of the actual administration. That means working with the individuals that they're getting the vaccines into to schedule appointments, make sure that it's done in an orderly way, make sure that the reporting is done, and we're collecting that information over time. The priorities for the vaccinating we are doing now, which is phase 1 of our vaccination campaign, has been focused on healthcare workers and residents in congregate settings, and has also involved those individuals and more in some of our harder hit areas. I want to spend a few minutes talking about the fact that our prioritization has been driven by the data and the science, and let me tell you about that. Healthcare workers, as we know, are on the front lines of this pandemic, and we need to protect them so that they can protect us. That's in particular our healthcare capacity system. Among older Rhode Islanders and those in congregate settings who test positive, roughly 21% are hospitalized with COVID-19 if they are infected with it. And among people in our high-density communities who test positive, roughly 13% are hospitalized. In contrast, among the overall lower-risk adult population, fewer than 4% of those who test positive are hospitalized. That's an example of why the groups we have shared are in our phase 1 priority group. We want to focus on minimizing hospitalization risk and saving lives. We know for preventing spread of COVID vaccine, wearing masks, distancing, and washing your hands works. We want to focus on being able to preserve our healthcare capacity, minimize how many people are hospitalized, and save lives through our priority distribution of the vaccine. Within our broad categories of prioritization, I want to provide a little more detail on who is being vaccinated this week and who we envision being vaccinated next week. Please post the graphic with the populations being vaccinated this week for everyone to see. So I mentioned the vaccinating that the pharmacies are doing in nursing homes, and that is continuing this week. That's how seniors are our priority population, and recognizing that that's a population at highest risk of percent hospitalization. That's where we are focusing. By the end of this week, all nursing homes in the state will have been visited at least once. The pharmacies are going to be reaching out to each nursing home to make sure that there is a visit for vaccination administration, a total of 3 times. On the healthcare worker side, many hospital workers have been vaccinated and are receiving their second doses now. In the outpatient provider setting, we have urgent care staff and respiratory clinic staff who are getting vaccinated, along with individuals who are actually doing the swabbing for COVID-19 in those settings. We're continuing to also hold clinics for emergency medical services personnel, school nurses, and others. The Rhode Island National Guard, an invaluable partner to us throughout this pandemic response, is operating a clinic at Sockanosset for people who are doing COVID-19 testing, some pharmacy staff, and staff from our 2 alternate hospital sites as well. Some limited vaccinating is still happening in Central Falls, too. Please next post the graphic for the populations that will be getting vaccinated next week. For the week of January 18th, we are continuing with many of those same groups, again, based on the supply that we have. One big change is that we will be getting additional group home residents vaccinated, particularly individuals 65 and older, and people in elderly housing with residential services and assisted living facility residents. That is how we're continuing to focus on our senior population who is at high risk. The majority of the first doses coming in now will be used for assisted living facilities. As I was explaining, while we are administering as much vaccine as we get, we are usually administering the vaccine physically received from the previous week because of our operationally complex process to get the vaccines distributed to the appropriate locations throughout the state. Next week, we also expect some limited vaccination to happen for more of our outpatient providers. An example is an outpatient setting. An example of an outpatient setting is your doctor's office or your dentist's office. This group also includes our important behavioral health care providers. We want all of these outpatient providers to know that they have been prioritized as well. And while we had plans for distributing once we receive the supply for January 25th, we have been able to mobilize the adjustments that the strong team has put in place so that we can get started a week earlier. This is a large group, so we will be vaccinating this group for several weeks, while the other groups are continuing to be vaccinated. Healthcare providers in outpatient settings, as we get this process started earlier than previously shared, we want you to know that you don't need to take any additional action yet beyond completing the survey that has already been sent to you so that we could be ready once we were able to create this opportunity to start earlier. After we start with the healthcare providers in outpatient settings, we're going to starting vaccinating some of the remaining older adults more broadly. The vaccination of older adults altogether, which started several weeks ago, is continuing to happen incrementally. We started vaccinating older adults in congregate settings, such as nursing homes, since the end of December. We'll be continuing with residents of assisted living facilities and some other residence types, as I've outlined. We will need to take an incremental approach when it comes to older adults and our other priority groups because of the large size of the population and because of the limited vaccine supply that we are currently receiving. The next big step will continue to be sometime early next month, opening vaccine up for all adults, all older adults 75 years of age and older. We've already started that process and will continue to expand it. I want to take a moment to acknowledge that there was a lot of news yesterday about the federal government urging states to vaccinate people who are 65 years of age and older. We want to be clear that we fully agree with that. We have that prioritized. We want to get vaccine out to people older than 65 as well. We also want to move to individuals who have underlying illnesses. The key to understand is our system is in place and ready to do that. The limiting factor is not federal rules. It's not our approach in Rhode Island or what the systems are. The limiting factor is the amount of vaccine we are getting. Again, less than 2% of the population each week. What we receive, we get out. If we receive more, that's going to allow us to really get at the populations that we want to. For the individuals in Rhode Island, for example, who are 65 years of age and older, that is 190,000 people. If you know that we are getting 14,000 a week and 190,000 individuals is just one of the priority groups that we have, it is challenging to move any faster than what we are doing right now. But we want everyone to know how we are handling this. It would not be responsible or honest or fair for us to otherwise say to you, all Rhode Islanders older than 65, just go get vaccinated tomorrow. The federal government has said it. They haven't given us any additional supply to achieve it, but yes, go ahead and get vaccinated tomorrow. We just don't have the vaccine supply to do that right now, and we don't want to be irresponsible in how we're communicating with you. We want to make it so that when we say, yes, you can go ahead and get vaccinated, the opportunity is there, you know when, that scheduled time, right away, you're able to get the vaccine. Other states have approached it differently, particularly with the feds saying what they have said without giving the additional vaccine. They have said, yep, we're opening it up as well, knowing that there isn't vaccine available to provide for them. And so you see situations where older adults in Florida have been waiting in lines for hours, only to be turned away because vaccine is not available by the time they get to the front of the line. I have personal experience myself. I've spent hours on the phone helping with my mother who lives in New York. She's older than 65. New York has said that people older than 65 can get vaccinated. We've called, we've texted, we've looked and tried to get an appointment. Nothing is available for her for this week or at all for several weeks. What's resulting in many of these states and other locales is a lot of confusion and disorganization. Our focus is to make sure that we are upfront with what we have available, that we have our systems in place, what we receive, we are getting out, and that we're continuing to coordinate with our federal partners to give the additional vaccine that will allow us to increase vaccination to the priority groups that we would like to vaccinate. In Rhode Island, we are vaccinating older adults incrementally and thoughtfully. That means when we tell you you can get vaccinated, you will actually be able to go somewhere and get vaccinated, as opposed to just being quote unquote eligible to be vaccinated and then be frustrated. We know that there is tremendous demand for vaccine right now. We are very pleased with that. actually. We understand why. It's been an enormously trying 10 months for so many Rhode Islanders, and we are glad that people are ready to get vaccinated. We want to continue to encourage that, so that as soon as we have the supply, we can make sure that it gets administered to the individuals that need it. After this virus has taken so much from so many people, we all see the vaccine as a way to keep ourselves and our loved ones healthier and safe. If we could, we would make sure that everyone got vaccinated right away tomorrow. But we need to get the vaccine supply in order to do that, and we need you to hear that we are doing everything we can with what we have. So please continue to be patient with us, continue to be engaged with us so that you're ready as soon as we receive the vaccine supply that we need. There is no vaccine wait list to get a vaccine. There's no vaccine sitting on a shelf anywhere in our state. As soon as vaccine is available for you, we will let you know through the press, on social media, and in a variety of other ways to make sure that you have access to it. I'm going to stop with that, with the encouragement that our winning formula, as the governor has shared, is vaccinations, expanded testing, and treatment. We want everyone to be able to access those resources and tools. As we have it available, we are building it to make sure the capacity is in your hands so you have what's needed getting through the finish line of this to be able to effectively protect your household.